I think one of the most important things is what we're talking about here together, which is these educational gaps, patient needs, and really what we need to get as far as the message out there. I think we've talked about three major areas. One is just awareness of the diseases themselves. Sometimes some of these diseases are so rare, such as the 8p11 syndrome or systemic mastocytosis, that many providers have never seen a patient case, or maybe even more importantly, folks don't know how to look for those diseases because they may require certain cytogenetic or molecular tests. So I think disease awareness for patients and providers. Number two, I think another gap is when you are diagnosed with a rare disease, how do you get reliable information about that? A simple online or Google search often is not enough for either a community provider or a patient or a family member. And so, as you all know, I'm a very big fan of getting the message out there ourselves, whether that's on Twitter, social media, even LinkedIn, whatever platform it takes to get the information to those who need it. And then third, I think a very important gap is that these classification systems change actually quite frequently, and sometimes not only the disease changes a group or a category, it can change names. And one of those is an ultra-rare disorder that I treat, now known as BPDCN, but that name has changed half a dozen times, and each time a new classification system comes, it's in a different group. So I think those are the challenges that many face, and I think if we work together, we can educate ourselves and each other.